Thank you.
All right, next up, Dr. Jeff Wilder, representing the Wisconsin Chiropractic Association.
Good afternoon, Chairman Moses and members of the committee. Thank you very much for allowing me to testify. My name is Jeff Wilder. I've been a chiropractor in Madison for over 42 years. I'm representing the Wisconsin Chiropractic Association, who is fully in favor of AB 507. Wisconsin healthcare consumers face significant challenges in getting their covered services paid by their insurance companies. The system is complicated. Most of us would agree that's probably by design. Consumers or their employers pay for the health care in advance, but often have real difficulties getting that money back to actually pay their bills. The bill that you have before you would resolve some of these issues. I'm going to take a look at 4 different problems that our patients have reported to us, and they fit in with the bill. The bill offers some remedies for those. The first is prior authorization. If we go back far enough, we'll remember that prior authorization was voluntary. My staff could call the insurance company, explain that we had a patient who had a particular problem, and the insurance company would allot a certain amount of treatment, and in fact would nearly guarantee that treatment. That was a win for the consumer, the patient. It was a win for our office, and we think it was fair for the insurance company. If we flash forward to today, we see that prior authorization has morphed into somewhat of a monster. Consumers are being told that they must have prior authorization in certain plans for certain professions. When they provide the information, as you've heard other speakers say, there are significant delays. The benefits, most importantly, are not guaranteed. Typically, the patient will receive a disclaimer that says, even though we're providing these many benefits, they are not guaranteed until the claim is actually processed. And that's when you'll learn whether this is going to get paid or not. So today's prior authorization has become really an administrative hoop to jump through for the patient and the chiropractor, with no benefit to either. This bill would prohibit the use of prior authorization for the first 12 visits, but would still allow the insurer all of their retrospective reviews. Another problem that patients report to us is they're presented with unequal co-payments for different professions. So a co-payment, of course, is when a patient has to pay a fixed dollar fee, say $20, to see their primary care provider. But certain providers, under the terms of certain plans, are charged at a higher co-payment rate, $50, $70, $100. So by putting the chiropractor in the specialist category is, of course, a disincentive to using the chiropractor in the first place, and it's clearly discriminatory. And we see this varies from plan to plan to plan. A third item that our patients tell us that they run into is a lack of transparency in the denials of claims. The patient receives a denial of care from the insurer with little or no explanation. The bill in Part 3A would require that the notice from the insurer reference the applicable policy and include an explanation to the service provider, and, this is very important, in plain language to the covered individual for any denial of coverage or reduction in covered services. And there's also a section in 5A that would provide, upon request, all medical evidence-based policy info that encompasses the algorithms used to manage the coverage. A fourth and final that I'll talk about today, area where our patients complain about this, is the inappropriate use of claims data. Now, they don't know that that's the phrase, but what they tell us is that the patient receives a denial from their insurer resulting from a review by an outside firm. These are typically utilization review firms. The denial might state that there are too many services, more than average number of services, or other statistical measures which are not clinical. It has nothing to do with the patient's recovery or lack thereof. It's a number. It's an arbitrary number. This bill would address that problem by stating that a utilization review organization or utilization management organization may not use claims data as evidence of outcomes for purposes of developing an algorithm to manage coverage of an approval policy for coverage. So, in summary, this bill would address several areas of specific need. There is a great need for increased transparency by the insurance companies in all these measures. The current pre-authorization systems that companies are using have no regulation, no transparency. It is a blind box. The company is allowed to do whatever they wish and say whatever they wish in the pre-authorization programs. Thanks for your time. I'd be happy to take any questions that you might have.
Do you have any questions for Dr. Wilder? All right, hearing none. Thank you for your testimony.
Thank you very much.
All right, next up we have